Hello listeners, welcome to Views on Health. A great pleasure to have with us back on the program Dr. K.V.C. Janaka, consultant physician, Sri Jayawardhanapura General Hospital in Kotte. Dr. Janaka last time around spoke on the importance of exercising for patients. Tonight, he is going to focus on the management of chronic diseases in the elderly. Without any further ado, over to you, Doctor, to introduce this topic.
Good evening. Now here, what I thought was that actually this was put to me by a patient yesterday. She asked, "Are you not going to the radio program?" Because I didn't come to this program for a long time. She said, "No, but I have to go this Monday." Then she said, then I asked, "What do you want me to talk?" Then she said, "Talk about elderly people." So I thought I'll talk something from what she asked.
That's great, Doctor. Thank you so much for that.
Yeah. So I thought I'll focus something on. Now, we usually manage patients with chronic diseases like diabetes, high blood pressure, heart disease and things. And we treat a lot of older generation. So what we should be doing when we are treating an elderly person is, now we have to think few things. One is that there are issues with their compliance, because most of them don't like to take like any patient don't like to take a lot of tablets. So that is one, the compliance. Then there are issues like appetite issues. Then sometimes there can be problem with swallowing, and sometimes they tend to forget things also. So if you give complex prescription, like you take half in the morning, one during lunchtime, again half in the night, or something like that, they might miss. They can get confused with that also. And there are physiological problems also. Like when you are older, your body has less proportion of water compared to a child. So you tend to get dehydrated very quickly. So we are very careful in that sense. So one is that. And there are issues with balance. There are issues with sleep. And there are issues with muscle strength. So a lot of things to decide. And most of things, sometimes their life expectancy may be low due to various conditions. So then again, now we are not trying to achieve the targets. What we want in a young man is not the targets that we expect in an elderly person. So there are various things that affect how you should prescribe or advise an elderly person. I'll give a few examples and try to explain a few things. I'll start with something like high blood pressure again, which is a simple thing, and almost all 100%, I mean, not 100%, almost about 80% of the elderly people have high blood pressure. So it's natural for people to have the pressures to go up with the age, because our blood vessels get thicker and they become more stiff, and the pressure gradually increases with age. Is a common thing. So when we treat the elderly, we choose the drugs. There are the difference in drugs also, because the pressure is mainly due to it's more due to the wall stiffness. So when we choose the medications also, we decide what is best for an elderly person to start than a young person to start, the differences in the drugs. So there will be some difference which we think can start. And sometimes when you take the high blood pressure, again we use things like hydrochlorothiazide, which is a diuretic, or spironolactone or furosemide, which can make the person dehydrated quickly. So that is something we are worried. Again, other issue is the sodium. We get a lot of hospital admissions having low sodium in the blood, and then they becoming drowsy, confused, and sometimes brain damage also. So we are worried in that sense also. So when we give drugs, we think of that. Another thing that elderly people get affected mostly is the pressure drops, and they can have fall. The fall prevention is a very important topic in elderly management, because if you give a medicine and the pressure drops, when the patient get up and break a limb or hip or something, that's the end of the story. So we have to be careful when we want to drop the pressure also. We do it gradually, because we don't want them to have a postural dizziness or have low blood pressure when they get up and fall. So those are the things that we think of controlling the blood pressure. And the blood pressure targets also. Now there are evidence to say at any age it is good to have a blood pressure very good control, like 130 is good. Even in an 80-year-old, if you can bring down to 130, that is good. But we always think, is this blood pressure is acceptable for this patient due to the things that I have mentioned earlier. So that we don't go to target always. Sometimes we say your blood pressure is 150 systolic, 160 systolic, this is enough for you. Because we are not trying to achieve the guideline that is prepared for a young man. So sometimes we say that if you are all right with this pressure, but it's good if you can achieve the target to 130 systolic or less than 140. But even in those clinical trials, they have shown that there are issues with when you are trying to achieve those targets. So we have to be very careful in the blood pressure. So when you check the blood pressure at home in your mother or father, and if it is say 150, you don't have to get alarmed. But if it is 150 in a 20-year-old or a 40-year-old, okay, you have to be more concerned. But in an elderly person, it is high definitely. Ideally we should bring it down, but the doctor can decide whether to bring it down or not. Then when you take the things like mentioned about the types of the drugs, then the dosing the people, we try to give drugs that are the dosing frequency is less. Like we try to give something which we can take once a day or twice a day, rather than giving 3 times a day, because it's difficult for. Usually drugs are given by, especially for elderly, sometimes the drugs are given by their children. So they are not there at home during the daytime. So we try to make the prescription to mainly morning and evening drugs and avoid the lunchtime drugs. Because we use long-acting drugs in that sense, especially in high blood pressure. So those are the things that we are concerned in managing in high blood pressure. And if say somebody has a very short life expectancy due to say severe heart failure or severe lung disease or cancer or even severe dementia, if somebody's life expectancy is very low, then we don't try to give a lot of drugs and achieve the target, the blood pressure target that we want in a young person. We make it simple, we keep it in the safe range rather than making the ideal range. So that is one thing that we consider in treating high blood pressure. Especially the most important thing is to prevent a fall due to low blood pressure and to prevent having low sodium. Those are the 2 main things that we think.
Thank you, Doctor, for that very detailed and lucid introduction to the topic of management of chronic illnesses in the elderly. Now, high blood pressure, yes, to maintain, of course, the level of pressure, but it depends, as you said, from patient to patient. One might go up to 150 and you would still think it's not the best, but it's manageable, and you know why. Or in others, it will be down to 130. So it is, at the end of the day, very particular to that particular patient. There's no sort of the same sort of yardstick that measures it all.
Yes.
It doesn't. And also, thank you for highlighting the importance of preventing a fall. Now, this is something that many people, unfortunately, have to, what can I say, they do experience it, because either they are alone at home, or even if they are not alone, just going from one point to another point is enough to have a minor accident, and which can actually be not a minor accident, but then a major one, because if they have broken a limb or fractured their hip, then it becomes, of course, a big problem. Doctor, in such situations, I just like to get your advice. What should they do? Supposing somebody has had a fall, and hoping that that person is not alone, but there's somebody taking care of, at least to help that person. Should they lift the person, or should they call the emergency ambulance service and wait for the medical personnel to come and deal with it? Or is there a way that they can make the person comfortable, the patient comfortable on the floor where he or she has fallen? Could you please advise on that?
Yeah, just slight deviation from the topic. I'll just come to that. I'll talk about that now, and I think we can do a separate session on that, prevention of the elderly and how to manage that. But yeah, if somebody falls at home, we have to know what is the reason for fall mainly. That's a separate thing, because we do a lot of investigation and things to identify why the person has fallen, whether it's just slipping the leg, or whether it is due to low blood pressure, or whether there is a problem with the heart, or problem with the brain, or something like that. So it is always better to get a opinion from a doctor, take the patient to the hospital, get the opinion. And if there's pain or something, then better to do X-ray or something and see whether there's fracture and things like that. So it is always better to get some advice, because we find sometimes the patient has fallen and broken the limbs, but nobody has noticed that for a long period. Patient just lying on the bed, unfortunately, without if they had a surgery or something, they should be active and mobile again. So it is important. So we'll talk about that in detail in some other session also. Now, regarding the drugs in the elderly. Now, I just talked about the high blood pressure. Similarly, we'll talk something like diabetes. Now, diabetes again is very important. We know that we need to have a good control. When we are achieving the good control, our usual target is HbA1c of 7 in a reasonably controlled patient, or even sometimes 6.5, which is very low target in a young person. That is a blood sugar of close to 140 in the morning, fasting blood sugar, or below 140 is the target for a normal person. But if somebody has had diabetes for a long time, because when you're elderly, it means that most of the time they have had diabetes for about 10, 15, 20 years. Diabetes for a long time. And when their body's reflexes are also diminished, we don't try to achieve the tight control, because it's dangerous, because their blood sugar can drop too low. And if it drops too low, it can affect the brain and they can have brain damage. But if you just keep the blood sugar in a safe range, again, say, I would be happy with, and there are a lot of evidence also, if you would try to achieve the target in patients who have had diabetes for a long time, they have more deaths. So if I would be like in an old person, I would be happier to have a fasting blood sugar somewhere close to 150 times, so, which is not normal, which is not very high also. It's safe. We don't want very high sugars, we don't want very low sugars. It has to be safe range. And other thing, we as doctors consider a lot of other things, and sometimes we think of the the way the drugs act, because they are, as I told, the total body water is less, so the drug distribution is affected. Their kidney functions, most of the elderly, their kidney functions are reduced, so that there is issue with that. Then their appetite is issue, the number of drugs, so we think of that. And other thing we think is that again, giving diabetic drugs, it's have to be very careful about the, not like other drugs, the dosage. So it should be a simple regime, just one tablet a day or twice a day, not half, not quarters and things like that. Even after meals, the blood sugar, now we say diabetes is diagnosed when the blood sugar is about 200, above the 200 at a random level. So after meal, blood sugar of 250 should be okay for a elderly person. And people who had diabetes for a long period, they have a lot of other complications. They have problems with the nerves. So that is a different thing that we have to be very careful. They don't feel. So they have a high tendency to fall because they don't feel. So you have to be very careful when they walk around the house. They are mainly maintaining their balance by vision, not by the sensation on the foot, because you don't feel the foot. We call it proprioception, but that sensation where your foot is not there when you have diabetes for a long time. So their vision is important. So protecting the eyes again is very important, elderly, because because without the vision, especially when it is dark, when they can't see and they lose the balance also. Right? So that also is very important. And things like giving insulin, which is again for ideal control you might have to give 3-4 times, but in an elderly person you might say just give once a day a long-acting insulin, and we go with the average control.
Doctor, when you take medication, sometimes the patient may not be able to take the medication by themselves. I mean, he or she may not be able to, and then somebody else would have to give the medication. In the event there is some, I mean, I wouldn't say it's on purpose, but by mistake, they give a wrong dose. What is the situation if they give more than what they should give in a given situation by mistake? Or say the dose has been given to the patient and then the caregiver goes away, the patient might go and, if it is there, take another one. Yeah, how does that affect the patient?
Overdose is always a problem. No? If somebody, whether elderly or young, if you take overdose, there are issues. And it is very common with elderly people because they forget. They forget that they have taken the morning dose, then they repeat it again. It commonly happens. But if it is, most of the time it is not very dangerous because it will be just an additional 1 tablet. But even with the additional 1 tablet, in diabetes, the sugar can drop. So they can go into develop hypoglycemia. We have seen patients having that because they have taken a double dose. So we have to be careful, give extra sugar or something, monitor the blood sugar at home, or bring them to the hospital. So for that, actually it's ideal to have, like, there are containers where you divide the tablets morning and evening throughout the 7 days per week or for a month. There are special containers to put tablets, so then they won't forget it. So tablet dispenser boxes. Unfortunately, in our country, not everybody can afford those things, but those are the ideal way. In elderly people, you should give not in the packet, drugs divided according to the day and the morning and evening. Those are the ways to prevent this thing happening.
Having listened to you, doctor, it's interesting that when it comes to management, of chronic illnesses in the elderly, there's so much that one needs to take note of, and it cannot be just taken lightly, because it can obviously impact negatively on the patient. If they miss a dosage, what happens? Overdose is one thing. They miss.
If they miss a dose, a single dose, usually it won't cause major issue. For example, high blood pressure, if you miss the single dose, because the medicines have a long action inside the body. So there is some blood level inside the body. Even if you miss a single dose, the blood level, the drug level in the body, it will definitely go down, but not totally low. So if you miss a single dose, don't have to be panicked. Even diabetes, if you miss a single dose, again the sugar might go up a little bit, but don't have to get panicked, but it will come down slowly with subsequent doses. So only the sugar level will be slightly high. So missing a single dose, I think better just to, because trying to correct that might cause additional problems. Now, if you miss a single dose in the morning, you should not take double dose in the night. That is more dangerous. So if you miss the dose in the morning, just forget it and take the normal dose in the evening. Because if you take the double dose in the night, the blood sugar can go too low or the pressure can too low. So it is dangerous. So best thing is, if you miss a single dose, okay, if you have facilities, you can check the blood sugar, check the blood pressure. In few hours you can take it. But if you missed it totally, don't increase the next dose without advice. So it's dangerous.
So would you say that even for high blood pressure or any other of the
anything, don't double the dose without medical advice.
Thank you, doctor. Once again, time has caught up with us. So what is your take-home message?
The take-home message is that as doctors, it is our responsibility to try and give medicine according to the individual person, not according to the guidelines or the what is really necessary. But we should try to give only the essential medicine, what is best for the patient according to his various other conditions. From the patient's point of view, you have to have a regular system to take medicines regularly, and you have to come and tell your doctor if you have any problem with any of the medicine, rather than just continuing it. Come quickly to the doctor and say, I can't take this tablet, or this tablet make me dizzy, or something like that. Because what happens is, patients sometimes they don't tell us, they just stop it and just continue with the other drugs. They have to come and tell us, I can't take this, then we'll adjust it. So it has to be a good communication. And the people who are looking after the elderly also try to make their life more simple, and don't expect them to be normal always. Because children get panic when the blood pressure is slightly high or the blood sugar is slightly high. They try to make it normal. You don't have to make it normal. What we want is an acceptable healthy life, rather than having a normal values but not acceptable, or the patient is symptomatic.
Thank you, Doctor. So we place on record our grateful thanks to you, Dr. KVC Janaka, consultant physician, Sri Jayawardhanapura General Hospital in Kotte, for being with us on the program once again. And we certainly appreciate your valuable insight into this important topic of management of chronic illnesses in the elderly. Thank you, Doctor. My thanks also go to Sandaruwan Lianage for technical assistance. I'm Fatima Razi Kader, bidding you good night and looking forward to your company next Monday, same time, on Views on Health.